Hi everyone, my name is Tonka and I will prepare the presentation about the concussion. So concussions in US occur every year among millions of individuals, not excluding adolescents, children, and especially athletes. Common symptoms uh, that are considered as a symptoms of concussion are problems with balance or ocular, cognitive, and vestibular skills, and they vary a lot from individual to individual. And that's why we consider concussion as being a heterogeneous injury of brain or head. And these symptoms often persist for 4 or even more years after the concussion itself happened. So concussion is a head or brain injury that usually results in the loss of consciousness, and then it contributes in adding of development within 4 weeks of headache, dizziness, fatigue, irritability, problems with sleep, concentration, memory, or emotion, or at least 3 of those. That's why that's when we classify the injury as a concussion. Uh, And as I said, it's a heterogeneous injury that is very individual. And that's why it was developed the 6 different clinical profiles to assess the most beneficial and most effective treatment for individual. So the first profile is cognitive or fatigue, then it's vestibular, ocular, post-traumatic migraine, anxiety mood, and the last one, the 6th one, is a modifier also with sleep and is called cervical. And these profiles are used to assess the one of the 5 stages of severity. Well, I mentioned 6, but the last one is a modifier. Uh, and they are used for assessing the correct treatment. So treatments and recommendations for people with concussions are mostly important. Most importantly, are recommended to rest both physically and also cognitively, to help with brain and all organism recovery and prevent further damage to brain, as well as increased sleep is very important, mostly right after the injury occurs. And trying back to normal life and normal activities, even if it might be difficult at first, is encouraged. But I said that it's very important to rest, but on the other hand, scientists often argue that too much rest can be destructive, and especially when we are talking about concussion at athletes, as they are trying to prepare for competition, or people often get isolated from other people and lack the social life and the possibility of being socially involved, which may lead then to development of other mental issues such as anxiety or depression. So behavioral recommendations are also very important when we are trying to deal with the symptoms, and can be very beneficial. Sometimes are considered even more beneficial, mostly in the long term, when talking about the rest. And we are talking about lifestyle changes with adequate diet, hydration, and at least some degree of daily activity, but in the same way, not something where we can get even more injured or come to contact with other people. Sleep is important, stress management, and mindfulness also helps oftentimes. Other recommendations, which are very individual again, are cognitive rehabilitation, psychoeducation, exercise therapy, physiotherapeutic coaching, and staying physically active but in a safety way. And recently there are 3 drugs that are known have positive influence on cognitive symptoms of concussions and post-concussions. The first one is called guanfacine, and it helps with memory. The second one is enzogenol, and it was shown that it reduces self-perceived cognitive impairments. And the last one, which was shown with mostly effective way in the long run, is a methylphenidate, which help with being fatigue and help with processing speed. And in a long term, it can also help with memory, attention, and anxiety or depression. Other non-invasive techniques are magnetic stimulation, hyperbaric oxygen therapy, mindfulness, or also musical training. But it's very individual, and musical training, for example, can help with some patients, but it may actually be harmful to some patients. And very important is to not being absolutely detached from in the recovery from all life, but try to include a so-called exposed recovery model into the life. And that's when we put patients into daily lifestyles when there are stimuli that provocate symptoms with normal daily activities and environments, including like going to grocery stores, parties, going to work, to school. And these symptoms may get a little bit worse in short time, but over the time they become less severe and usually disappear after a time as we get used to them. And post-concussion treatment is very individual and depend on how severe was the concussion, how are we able to heal, how we behave, how is our commitment to the therapy. And one thing that is important is history of every individual and also history of every family and the health condition in the family and genetics. So here are five profiles to help with the assessment. The first is the vestibular profile, with symptoms usually including problems with dizziness, balance, sensitivity to motion, vertigo, anxiety, nausea, and people often feel mentally foggy. And the recommendation for this concussion is to engage in normal lifestyle every day, or also maybe incorporating dynamic exertion therapy or vestibular rehabilitation. The second is ocular profile, where individual usually have a problem with blurred vision or have troubles with focusing, mostly when they are reading something, are tired, have headaches, usually when they are trying to focus on something visually. This can be when in school or watching TV or reading something, and it's recommended for them to engage in activities that involves these eye jounting tasks, uh, or are also recommended to do vision therapy. The third is the cognitive fatigue clinical profile, where symptoms are mostly headache, which get worse during the day. Individuals have troubles with remembering and with memory. They feel like they are slowed down or unable to concentrate and focus on tasks. And they often describe as they feel like they are in the fog. And this can get worse, especially in the individual diagnosed with ADHD. And then they are recommended for often for medication with pills or drugs. And they need to pay attention, especially to their behavior, and should do work and school adjustment to be brief, to cut down so they can also relax, but also continue being involved in daily lifestyles. The third one is the post-traumatic migraine, which refers to the headache, which can be of different severity. It can be mild, it can be very hard, very severe. And the migraines can get worse with with the exposure to light, when we wake up, stand up. People also have you get motion sick, or they can see lines, stars, pulsation, and they also have troubles with sleep. And this is uh, usually more often seen in females patients, and this needs to be treated mostly with behavioral changes, uh, and people are usually referred to headache specialists to deal with the migraine and are recommended the medication afterwards. And the last is the mood and the anxiety, when individual can't stop worrying about things, and the flow of thoughts always come to the mind. And this can also result in panic attacks, detaching from social life, or being sad. And the symptoms usually get worse, or if individual or someone in the family history has or had psychiatric issues, or individual have problems with sleep or migraines, uh, as well as there can be certain situation or places or people that refer to like past bad experiences, and they serve as a life stressor. And this is usually treated in psychiatry setting with psychiatrists, therapies, medications, and therapy usually. But all of these recommendations for treatment are very individual, and as I said, any of those five uh, profiles are not exclusive. Like when someone has a concussion, it has just this or this type. It's usually a combination where we need to combine different treatment theories and practices. Thank you for watching, and have a great rest of the semester.